getting people in the door, and then you sell them on the engineering side of it. But being able to work on something like this is incredibly awesome and has gotten people lots of jobs in motorsports.
Student teams in the competition come from as far away as Spain and Venezuela. In addition to tech inspections, speed and handling runs, and a 13-mile endurance test, the cars are also evaluated for their production potential. It's going to be warm and dry today here in Northeast Florida. We're going to have mostly sunny skies and light winds this afternoon. That will allow for highs to reach the upper 80s to lower 90s. Low rain chances today and moving forward through the coming days. Above average temperatures in the forecast through the rest of the week. Highs tomorrow expected to be in the low to mid 90s.
Support for NPR comes from NPR stations. Other contributors include the estate of Joan B. Kroc, whose bequest serves as an enduring investment in the future of public radio and seeks to help NPR be the model for high-quality journalism in the 21st century. This is NPR.
Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning. I'm Ann Schindler, and this is First Coast Connect. Today, maternal mortality rates are declining in the U.S. for nearly all women, but deaths of Black women continue to rise and remain more than 3 times higher than that of white women. We talked to 3 local experts about the uncomfortable, untold truth. Later in the program, in addition to headliners The Roots and Janelle Monáe, the Jacksonville Jazz Fest is filled with local talent. We meet some and preview others ahead of Thursday's kickoff. But first, health disparities for women of color remain a troubling reality in the American healthcare industry, and it's an issue that has become central to the work of all 3 of my guests. Here to talk about it is Keitha Nelson, Good Morning Jacksonville anchor at First Coast News and creator of the Untold Truth series. Good morning, Keitha.
Good morning, Ann. Thanks for having us.
Thank you for being here. We're also joined by Dr. Chandra Adams, OBGYN and women's healthcare economist. Welcome back, Dr. Adams.
Thank you for having me.
And Dr. Chris DeStephano, gynecologic surgeon who specializes in uterine cancers. Good morning.
Good morning. Thanks for having me.
Thank you for being here. Keith, this has been a passion project of yours for several months now as a reporter.
Mm-hmm.
How did you begin to dig into this and to focus specifically on kind of health disparities?
You use the correct word, passion project. It really has turned into just that. And this all started back in late 2024 when I got a wind of a study being done by the American Cancer Society dealing with Black women. It's called Voices of Black Women. And they're pretty much taking a look at why it is that Black women are dying of pretty much all cancers at a disproportionate rate compared to all other ethnicities and races. And I myself was wondering, what is leading to this? What is the cause? And so this study by the American Cancer Society is trying to delve into just that. It's a 30-year study involving 100,000 women. So finally, a really substantial study is being done to figure out what's going on. And so that sparked all of this. But I could tell you, we did that series in October, but I recently went to an event with Dr. DeStephano, and he actually opened my eyes to something that was just shocking. The rate of uterine cancer in the U.S. when it comes to Black women and deaths. We're being diagnosed later, and we're dying again at a disproportionate rate. But what was really shocking is that he said these rates are going up and they will continue to rise as obesity rises in the U.S. So he said that, and I'm just like, okay, we need to talk. What is going on here, and what can we do to solve this problem?
And so I'll ask you that, Dr. DeStephano. I mean, what is the cause here? You particularly focus on uterine cancers, but you do minimally invasive surgery for, I guess, a variety of gynecologic cancer circumstances. Talk about what we know about why some of the rates of uterine cancer are so disparate.
So I am a minimally invasive gynecologic surgeon, so I focus a lot on actually benign gynecologic disease like endometriosis, adenomyosis, uterine polyps, fibroids. All of these conditions lead to vaginal bleeding. And we think what's one of the reasons is that vaginal bleeding occurs, more frequently in Black women. because of fibroids earlier on before menopause. And then after menopause, bleeding continues. And sometimes those symptoms are either dismissed by the patient or by the providers, and they don't have a timely evaluation or diagnosis. So that's one possibility for why these diagnoses are happening later. And we've done a number of research projects in order to try to detect cancer earlier. But with obesity, the adipose or the fat actually has estrogen producing enzyme in it called aromatase. And we think that is why, with obesity going up, that endometrial cancer is also going up. The reason this wasn't recognized earlier was a lot of the studies didn't correct for women who had their uterus removed. And so if you look at that, because of all the benign gynecologic conditions like fibroids, Black women do have their uterus removed more frequently than white women. And so the data didn't show these disproportionate rates of cancer or death until we corrected for it.
How recently was that corrected?
That was around 10 years ago.
Okay.
There was a large NCI study that looked at the epidemiology of cancer in Black women versus white women.
And Keitha, you mentioned that Voices study, and that has been a rallying cry for a lot of the coverage that you've done, which is to try to get women to enlist and to enroll in that research because it is specifically focused on women of color and their health outcomes. And so much of the research, I know that Dr. Adams will address this as well, but so much of the research to date has been improperly focused in a lot of ways. It hasn't sort of taken out, it hasn't focused in a way that allows people to diagnose appropriately and to kind of
Black women, in particular. Dr. DeStephano's just speaking just now, and I'm smiling because he just said it. The study was done about 10 years ago. Without the study, we wouldn't have known this. And that's another issue right now is that the participation when it comes to African American women in particular is not there where it should be. We tend to shy away from doing these research studies, clinical trials, because there's been a history of abuse, and for a lot of people that makes us to tend to shy away from it. But that's why this study is so important. Going to voices.cancer.org. This is why it's so important, because we all need to get involved. We all need to have our voices heard so that we can help not just us, but future generations of Black women. As I said, it's a 30-year study, so it'll take some time, but you have to think about the long term here. This is not just about, I say it all the time, it's not just about you. We have to think about the long game. So it's important to gather as much information as possible from all of us, Black women who are eligible. They're looking for women, by the way, between 25 to 55 who have not been affected by cancer to take part in this study. But without this research, where are we going to be? We need this research. We need to know so we could get some headway and save lives ultimately.
Dr. Adams, as an OBGYN, you know as well as anybody, plus the work that you've done, what Keitha alluded to, which is some of this history of abuses in medical research, beginning with the father of gynecology, as he's known, who abused and essentially tortured enslaved women who were part of his, research practice. Just a really horrible story of really just wretched treatment. And that in some ways has continued to be felt in terms of either exclusion from, research or sort of appropriate treatment. How far have we come?
So just to kind of go back and give a little bit more background on that, those experiments were based on the premise that Black women did not feel pain in the same way as Caucasian counterparts. And so he did not feel that experimenting on them, testing his different ways to repair lacerations after delivery, lacerations after using instruments such as forceps for delivery, and the resultant lacerations where women had tears from the vagina to the anus through the rectum. And it was just a perception that they just didn't feel the pain. And so he was able to repair and re-injure and re-repair and re-injure. And some of those women underwent tens, possibly even 100 different surgeries for him to perfect his technique. And even as recently as in the late 1980s, 1990s, there was still a perception that African American women felt pain or perceived pain differently. And some of that may have been because of the cultural expression. It's not seemly or appropriate for us to appear weak or express that we're feeling pain. And so it just wasn't believed as much in the medical community. And so, fast forward to now, it translates to when women are having conditions of pain. I can remember Dr. Reuben Brigady, the first African American graduate of University of Florida Med School, who was an OBGYN here for several years, discussed during his residency when African American women came in with pain, they were diagnosed with pelvic inflammatory disease, which was a result of sexually transmitted infection. And white women who came in with pain were diagnosed with endometriosis, which did not have the same social stigma or stipulations of treatment or
Wow.
care. And there was a lot more judgment with that. And so now there is more of a push of listening to Black women. That was an amazing campaign that started in 2020. Listen to Black women and consider the entire spectrum of diagnoses that we may have that are similar to our counterparts.
We are talking about health disparities in medicine. We're also talking about maternal mortality rates among Black women, as well as elevated cancer rates. And you are welcome to join our conversation. You can give us a call at 904-549-2937 or email firstcoastconnect@wjct.org. We've got a call from Nancy in Atlantic Beach. Good morning, Nancy. Go ahead.
Good morning, Ann. I am a white woman with the exact same condition that the people are talking about now, your guests are talking about now. Had breakthrough bleeding all the time. Finally, at 65, someone listened to what they called staining, but someone finally listened and did a total hysterectomy, and it totally stopped. I had no other sign, and so doctors didn't consider it necessary to do a total hysterectomy. So at 65, I finally solved this. My reason for calling is to say, if you're a white woman and you've decided that this is geared toward Black women, please don't discount this conversation, because an awful lot of it, I have goosebumps, an awful lot of it rang true with me also. So thanks to your panel, and again, as always, thanks to you.
Thanks, Nancy. We also have a message on Facebook saying these conversations are crucial because awareness is the first step towards equity and change. Dr. Adams, I want to return to you because your area of expertise in part has to do with, the pregnancy-related complications, sometimes before childbirth, sometimes after childbirth, that can be really lethal, particularly for Black women. And we know that Black women are 3 times more likely to die from pregnancy-related complications. It really is a astounding statistic that 50 out of every 100,000 live births result in death for Black women compared to 14 for white women.
Yes. So the two things that are killing women, Black, white, whomever, in labor are hypertension and hemorrhage. The statistics regarding deaths surrounding birth, we have to also remember, include all types of deaths up to a year after delivery. So these also include domestic violence. These include other types of violent death or tragic, just non-related to. But the ones that we focus upon are the ones that are preventable from the standpoint of the medical community, and those are hypertension and hemorrhage. So hypertension, specifically preeclampsia and preeclampsia-related disorders, which occur when the placenta gives off hormones that change the cardiovascular panel of the mom. And there are certain conditions that exist prior to pregnancy that predispose women to develop preeclampsia at higher rates. So if there's pre-existing hypertension, if there's pre-existing diabetes, any type of kidney disorder, obesity, as Dr. DeStephano mentioned, also contributes to increased risk for these. Then you have an increased risk of preeclampsia. And preeclampsia is basically the eclampsia is the seizure part of it that can lead to stroke and can lead to heart failure and cardiomyopathy, which can lead to death. The most dangerous time for preeclampsia, when people hear preeclampsia, they think prenatal and they think, oh, after the baby is out, I'm safe. The most dangerous time for preeclampsia is in the first 14 days after the baby is born. And that's where a lot of these statistics are coming from.
And you've said that something more needs to be done in terms of educating people in the ER or people in the field of obstetrics generally, that you have to know that the risk is higher for Black women when you're making a recommendation about whether you should go home or whether this poses a threat, because the outcomes are different. You have to allow for that and you know encourage people to be staying in the hospital if they need to, given that additional risk, not be sent home. And that's a matter of training, but also policy changes.
Policy changes, absolutely, because with utilization, we're in a rush to get people out of the door. You want to turn the beds over, have more people available to be able to come in and deliver. And so there are some places that have policies you can leave as early as 6 hours, 12 hours, 24 hours after you have a baby. And sometimes those blood pressures aren't going up until 24, 48, 72 hours. And then the mom is at home, and if you've ever brought a baby home, you're not taking your blood pressure every 4 hours to make sure that you're feeling okay. You're barely sleeping or eating or drinking water. And so you can actually explain away a lot of the first symptoms. Oh, I'm just tired. Oh, I mean, I can my own personal story. When I brought my newborn home, my oldest, after feeding him, I was about 10 days out. My left arm went numb, and I explained it away to myself, saying, oh, I was just holding him on the left side, and so that's why I don't feel this. And the feeling didn't come back. And so a couple hours later, I had my husband check my blood pressure, and it was 180 over 120, and I immediately went back to the hospital.
Wow. Keitha, in your reporting, you have talked to some mothers, you've talked to some friends of women that gave birth and did not survive, and because of things like preeclampsia. But you also spoke to a couple that told you their story about, they were sent home at 39 weeks
Yeah.
while she was pregnant with high blood pressure.
Yeah.
And she really felt wronged by that diagnosis and treatment by her doctor.
Um, you know what? I want to touch on this. It's she what you're saying about Shay was the young lady's name, and Nancy, your caller just now, she said something that I think we have to hammer home, and the key word here is listen. Listen to your own body, listen to your own mind, and make sure your healthcare provider is listening to you. Advocacy is key. I'm telling you, speaking into these women, so many times you hear them say, I believe I'm still here. My life has been saved because I made sure that my healthcare provider listened to me, that I advocated for myself. In Shay's situation, the young lady you just mentioned, she didn't know. First time mom, her husband as well. He didn't know. He didn't know to say, wait a minute, I can't go home. And if you don't know, how do you know to do better, right? We don't know until we do know. And so the key again, after speaking with all these women, is to make sure that you're listening to your body. And again, make sure that your healthcare provider is listening to you. Make sure that you are ready and willing to put up that fight and advocate for yourself. That's how you're going to save your own life, plain and simple.
Dr. DeStephano, you work pretty hard in the work that you do to really involve, your patients, make sure that they're kind of part of understanding fully their illness and, a partner in the solution. But it is hard for some people to push back, to question the doctor's authority if they're not sure, if they're feeling uncertain, or if they're trying to listen to their body and their doctor's telling them something different. Do you have advice for patients, just kind of based on your experience, about how to handle those sometimes difficult conversations?
I think coming in prepared, starting before the appointment, just knowing kind of what to ask, looking it up. I, as a provider, even am using, Chat GPT and AI and all the education tools that are out there. American Cancer Society, Mayo Clinic's, website. There are plenty of kind of education. So I always, for myself, as a patient, or with taking my kids to appointments, I always come prepared with kind of what I want to discuss. And then, so that sets some expectations. Then with the provider. If you're noticing a disconnect there, you follow up with them about those recommendations, ask, multiple different ways. And if you're still not feeling comfortable with that, then I think it's at that point, getting a second opinion. I can't say it enough that, we want you to get a second opinion so you get the best care that you can, so that you feel comfortable with whoever you're going to have deliver your baby, take care of you postpartum, or have a surgery that, has risk for complications.
How did doctors feel about being, audio recorded? I feel like you leave the doctor's office and immediately 80% of what they said is gone, and then you kind of have a grasp of maybe 10% really clearly, and then the other 20% you're sort of trying to recreate. But I would guess that sometimes that's uncomfortable for doctors. What is your feeling about that?
I think it is uncomfortable, but I think more and more we're going to have to develop new policies around that in order to become more comfortable about it, because I do think the recap features of some of these programs are very helpful for patients to remember, what was said to them, and beyond just note taking. And so I think over time, as long as both sides of the provider and the patient are aware that the recording is underway, that I think there needs to be consent there to make everyone more comfortable.
I encourage it at my office, actually, because I can't tell you how many times I've had a conversation and the patient comes back and said, well, you told me I should definitely do this. And I said, no, what I said was you should absolutely never do that. And so, it's helpful for us too. And as my practice grew, I think now we're up to 9 or 10 providers. We have meetings to discuss where we are, making sure we're all on the same page with regard to the plan of care for someone who's going to be coming in laboring or delivering. And in those meetings, there's several times where it says, hey, your note doesn't reflect that your conversation told her to do this. And now the patient is confused about it. And so being able to have that recording and go back and say, yes, absolutely, this is what was discussed. And this was the plan of care, and you agreed or didn't agree, or these are the questions that you asked, or these are the ones that you didn't get answered. That's, I think, very important for both sides in this conversation.
We have an email from Kelly saying, so glad my favorite OB is on this show. She has the best OB midwife partnership practice in town. We also have a call from Curtis on the north side. Good morning, Curtis. Go ahead.
Good morning, Ann, and good morning, everyone. I'm calling because Dr. Adams mentioned Dr. Briggity. My wife and I know him personally. He was my wife's gynecologist, and he's short in stature but has the heart of a giant. And my other comment is that I feel personally that society is failing our young people, especially the young females. I believe that every female, regardless of race, color, creed, is special and is beautiful. I hear them talk about sex education in school. I'm always listening to that. And I think they focus too much on intercourse and not the makeup of the body, especially the female body, what transpires when the female body changes and the changes that the woman body go through. I love this program. I just don't think there's enough information out there being pushed through the schools and through media about how serious the female body is. Thank you so much, Ann.
Thank you, Curtis. I appreciate your call. Interestingly, we just got a message from William on Facebook sort of echoing that, saying, as a father and grandfather, can this information be shared in high schools in an academic program? This is so serious because women are dying and families are negatively influenced because of this. Keitha, I know that, your station has done school outreach in the past on some topics. Is that anything that you've been approached about or thought about or explored?
Well, I'm going to. So it's an uncomfortable situation, uncomfortable conversation for sure to have, right? When you start talking about anatomy, the body, the changes to your body. I've got to tell you, even myself, some of the things that we spoke about when I spoke to Dr. DeStephano, I was like, can we go there? Should we go there? But we decided to do it, because as we just heard there mentioned, we need to have these conversations. But in terms of going into the schools, that's something we'll look into maybe, a little farther down the line. But again, these uncomfortable conversations, you tend to have to fight a little bit, which I'm always willing to put up a fight. Let's put that there. But it might be a bit of a,
Yeah.
a battle.
Yeah, well, I want to ask you about that too, Dr. Adams, because some of the recommendations that have come out based on the research, based on our knowledge now about this health disparity and kind of how many places it manifests, have, had specific suggestions, things like increasing the number of Black and people of color who are in the world of obstetrics, or testing at the licensing, stage, at licensing boards, doctors for proficiency in recognizing bias and making sure that they, are culturally competent. And those are things that are tools believed to help remedy some of this disparity. And they're also the very kind of thing that are under attack in a lot of places, including here in Florida, when it comes to something that has a tone of diversity, or equity or inclusion. So where do you see those kinds of recommendations going given the current climate?
We hear the phrase over and over again that representation matters, and we see it in how patients interact and have a sense of trust with their care providers. And so I emphasize to my patients all the time, yes, you may feel more comfortable with a provider who looks like you, but there is a saying also that all skin folks aren't kinfolk, which basically just means that just because someone looks like you doesn't necessarily mean that they sympathize or empathize with your condition. And we can have allies in all colors. We can have allies in all ethnicities. And I think it's important for those who are allies to call the thing. And to say out loud, many African American women in my practice have been surprised to hear, they come in and say, I only want to see Dr. Adams because they see my brown face and they think, okay, that's my friend, that's who's going to take care of me. But many of the providers in my practice are not African American. And women have come back to me and said, I was really surprised to hear your midwife say, because you're a woman of color, these are the things that I'm going to be specifically looking for. And that made them feel safe, and that made them feel heard, and that made them feel that they were in a place where they were being taken care of. And so it is important for us to have representation, because I think that keeps it on everyone's radar. Like if they possibly if they weren't working in my practice, that wouldn't be a conversation that they were having in another practice. But I regularly say to my providers who are not of color, listen, these women are coming to you and they are scared, and you have to acknowledge that before you proceed with your discussion of them, because any dismissal that they receive, they're going to perceive that it is because of their color.
Dr. DeStephano, I'm curious how you handle that because, we had a question come in on email, I believe, asking about this link with obesity. How do you kind of explain to people risk factors, perhaps some lifestyle factors, and do so in a way that shows that you are, both empathetic and not judgmental about, kind of people's lifestyles when it comes to certain kinds of cancers? Particularly if you're dealing with somebody who, is of a different race or ethnicity than you are.
Yeah, it has been something practice. I mean, practice is the main thing. You try to get into more diverse environments in order to, learn how to have these discussions. You learn from the experience. Sometimes things, I make mistakes in how I communicate something, and then I learn from it and I ask for feedback on, what I said. But the I always start with questioning and inquiry and just asking if they want to address this. So there's kind of this 5A model for motivational interviewing that you start with just ask if they want to cover, smoking or, obesity and discuss that. And then you can provide some advice and assess, their willingness to change. There's two others I can't remember
That's
right now.
interesting, though.
But
So you kind
um,
of start to see if they want to engage in that because that can be a barrier for a lot of women if they don't want to come in and have the first thing that they're talking about be their weight. They're coming in for a specific reason and sometimes feel like the medical world makes an initial judgment and that's all they want to focus on.
right. And usually you start with the symptom too. And so most people are coming to me with some kind of symptom, but a lot of times I need to ask about that symptom because people might not necessarily be comfortable talking about menstrual bleeding with me or, what's happened in the past to them with regards to their birth history. There might have been trauma there. So there's a lot of potential history there that I try to just ask, and they don't have to necessarily answer. And I say, is this okay to ask about this? But just being very open-ended about the questioning and to get at, the risk factors and then whether they want to talk about them further.
Keitha, one of the families that we were talking about that you spoke to they're pregnant,
Oh, shit, yeah,
right?
yeah. And she was, and oh gosh, Dr. Adams, I've got to tell you. When we had a conversation, she said what hurts her personally, Dr. Adams, is seeing Black women in particular being reluctant about growing their families because of sometimes experiences they've had as well as stories that they've heard of friends or family, whatever. And it's so true. It's so sad that now you have women, because I spoke to at least 2 within the story, that are afraid of starting a family, growing their family, just because of, if not their own experience, then what they've heard other people experience. It's a sad truth. Yes, Shay and her husband are happy. They have a child on the way, but still in the back of their mind, am I going to be treated different because of my race? Am I going to be ignored? My symptoms, are they going to listen to me? So yeah, it's a sad reality. Some folks are reluctant again to grow their families because they're afraid. They're afraid.
And this is not their first time, and
No.
they are going to move in with more understanding. And do you think
That's
they feel
a good thing. That's
Yeah.
a good thing, right? So, doulas. How come we didn't, Dr. Adams? Let's talk about that because she was pushing this as well. So it's so important to have someone there to hold your hand through the process, especially if you're new to it, right? Because there's a lot of things that we just don't know. So,
and advocate?
yes, I'm a big advocate now for having a doula, having someone there to help you out. And I spoke with one of our senators recently, and she was explaining to me that they're working on a Medicaid package for the next session, a comprehensive package that will include doula care being included in Medicaid. Because right now it's not covered, but so yes, there are there's some headway being made, some gains to try to help out so that we cannot be afraid, to grow our families.
And we do have a question, Dr. Adams, that says, is there info available to women who want to learn about their bodies before getting pregnant, kind of specific to all of this? Is there like a good resource website that you steer people to?
So I encourage people to go in for preconception counseling. We all learned preconception counseling in residency, and then we were very disappointed, I'd say, to get out and start practicing and realize you never get to use it because no one ever comes in and asks, what do I do? And so probably in the last 20 or so years, I've done maybe 5 real preconception counseling sessions. Typically, it's people who have chronic illnesses or are on certain medications, and they come in, they wonder, what do I need to get off before I start trying? How long do I need to be off of this? But every once in a while, I have someone who's perfectly healthy and comes in and says, I'm thinking about getting pregnant in the next 2 years. And I get so excited. I'm like, all right, let's go down the list. So I encourage people to have that conversation ahead of time. Things are a little different now with women, postponing pregnancy for careers and waiting for marriage, trying to find Mr. Right or what have you. And so a lot of times we spend a lot of time trying not to get pregnant. And then suddenly there's a big rush. It's okay, the wedding is in September and we're going to try to get pregnant on our honeymoon. I'm like, hold on, can we talk about it, before you stop the pill or pull the IUD or whatever. But having those conversations with your doctor ahead of time, and even finding out what's your doctor's philosophy about birth. How do they view the maternal crisis? Do they believe in it, so to speak? Because I've had patients even come to me and say, I tried to have this conversation and they just didn't believe in the maternity crisis.
Wow. Well, there's so much to talk about, and I really appreciate you all coming on today to share some of your insights. Keitha Nelson, Dr. Chandra Adams, Dr. Chris DeStephano, sorry.
We keep on butchering his name. Once for the record. One more time for the record.
Chris DeStephano.
Chris DeStephano. Thanks so much for being here. Really appreciate you.
Thank you.
All right. Up next, behind the headliners, we meet some of the local talent performing as part of the Jacksonville Jazz Fest. welcome back. Well, some of the greatest moments of the Jacksonville Jazz Fest take place during collaborative sessions away from the main stage. Here to tell us about where to look for those moments of spontaneity is John Lumpkin. He is a jazz artist, educator, and founder of the Jazz Discovery Series. Good morning, John.
Good morning, Ann.
Tori Peoples, Director of Institutional Advancement at the Jacksonville Arts and Music School and a incredible jazz vocalist. Welcome, Tori.
Thank you. Good morning.
And Langston Oliver, welcome back, a jazz trumpeter extraordinaire from here in Jacksonville. Good morning.
Good morning.
So, John, one of the festival traditions is the Jazz Jam, and that's something that you have organized, and the folks on the show today are going to be part of that. Tell us, for people who haven't been, what is the Jazz Jam?
Well, the Jazz Jam is definitely rooted within the traditions of the music, to whereby which musicians come out. There is a set band that is there just to be able to keep things at a certain level musically. And pretty much musicians come in and they sit in with that band. And sometimes musicians can actually sub out, if you will, like another drummer could come in if I'm playing or whatnot. Another vocalist could come in, a pianist. So it's just this ongoing thing that happens creatively between creatives.
Yeah, and so you kind of are bringing in fresh troops as you're going, building the airplane as you're flying it. Tori, you had a really good analogy of what it feels like to be part of that group.
Yeah, I, as a vocalist, improv and in a session like this is both, scary and it's extremely liberating as well. So you never exactly know where you will go from one point to another, but it is truly a beautiful moment to share with musicians and with audiences as well.
Yeah, the magic of that inspiration.
Yeah.
But you were describing John kind of pulling together all of
Oh
these.
yeah, it's like pulling the Avengers, if you will.
Oh yeah.
And making a powerhouse in music. So
Yeah, super group, right? And Langston, you have worked with John for years now. You also have worked with some incredible names in music, including Wynton Marsalis. You have performed on stages with incredible musicians, and it was your music we were hearing actually coming in, and we'll hear some more when we close this segment. What is it that appeals to you about the Jazz Jam format?
I think it's really exciting because you're working with a bunch of different musicians who bring different perspectives. So you get to look forward to hearing those different perspectives.
Yeah.
And I think that's the best part about it.
Do you come with like a knowledge of what the repertoire is going to be? Do you know what songs might be in the lineup, or is it all just kind of like catch as catch can?
I think for jam sessions, there's kind of like a set standard that people call for tunes, but typically you kind of just go with the flow things.
Is it harder to do that kind of on the spot improv as a vocalist, do you think, than just as a musician in the band?
I think improv, it depends on your background. So a lot of us have grown up in the church, which is it is improv as far as flowing musically in spiritual moments.
Yeah.
So just like jazz, where your heart goes, where the music goes, you allow that to transpire in the moment. So it is, it's a special, moment to exchange with musicians. So you take a point of reference, or you take a sound and you expound on it. As a vocalist, maybe it's a word or two or a reference, and that triggers or spirals a movement in the music that you don't expect.
And John, you're sort of nodding along. I mean, that is a moment of inspiration, and you see the similarity between kind of the feeling that you have in the church and the feeling that you have when you're performing jazz.
Oh, absolutely. And I to have it be any other way would not be being true to myself. Even with the way that the session is formatted this year, it's rooted in a dynamic of New Orleans, and I was blessed to be able to just come from there for the Jazz and Heritage Festival, as well as what we have right here in Duval County. And it's my experiences on secular stages as well as non-secular stages, playing in churches, clubs, festivals all around here in the city. This jam session is going to be very special. I mean, from guys like Joshua Bolus, Corey Johnson, who I grew up watching play drums in church a lot and producing. Noah Green, who just came off the road with me with Leon Timbo, who's a Jacksonville native. These fine people right here, Marlon Allgood, who I went to school with at UNF, and also Jeremiah Hunt, who lives in Chicago but is a resident here, primarily here in Duval and creating and making this project. So it's going to be a culmination of all of that.
You know, it's interesting, Langston. John talks about the Jazz and Heritage Fest in New Orleans. New Orleans is the home of Tank and the Bangas. They're going to be performing at the Jazz Festival, and so are some other major names. You know, we mentioned Janelle Monáe, but also Kool and the Gang, The Roots. And some people say, well, that's not really jazz, right? The New Orleans kind of branded theirs or rebranded it the Jazz and Heritage Festival, kind of a broader moniker. But what about people who say, well, where's the jazz in some of those headliners?
I think it's in the culture, really. It's the people who are playing, right? Jazz has a very deep history, and so yeah, I would just go to say who the people who are playing. That's what it's about. Right?
Yeah. How about you, Tori? What do you think?
Absolutely what Langston said. Typically in settings of the Roots and Janelle Monáe and like the Robert Glaspers of the world, and in those jazz moments, you will hear references of jazz moments, or Thelonious Monk, or the greats. So you'll hear an homage to that again, because it is the heartbeat of a lot of the music that is out today.
John, I know your passion is, educating youth, and there are also a couple of youth ensembles here from UNF, from JU that are going to be performing. So that's, a very cool part of the Jazz Festival. But the piano competition is another big part, and you're sort of overseeing that this year.
Yes, primarily from the drum chair. Me and myself and Dennis Marks, we're going to be playing with a lot of pianists. We've done it before, and the one thing that I actually love about doing it is I get to put on all of these different hats to be able to communicate with the pianists that I play with, because they don't sound like each other. I mean, they're all coming from the same lineage, if you will, in terms of the music, but how they go about creating that, I have to follow that, and I have to own that and be in the moment with them. So for me as a drummer, as a creative, it's very exciting. I love doing the jazz piano competition every year.
And so we were talking about the Jazz Jam, which is going to be at Intuition Aleworks. That's on Saturday. The piano competition, I think, is on
that Thursday.
It's on the first day of it. Okay, right.
The 22nd, I believe.
Okay. And that's held
at the Florida Theater.
Florida Theater.
Mm-hmm.
Okay, terrific.
Yes.
All right. Anything that you're most looking forward to, Tori? Is it the jam?
Yeah, I'm really looking forward to that moment. I would say that there has not, to my knowledge, been an experience of this nature, of again pulling musicians and a vocalist in one setting, in a random and improv moment. So I'm truly excited about what is to come of that, and I believe the set is from 10 p.m. to 1 a.m. So it might get wild after 12. I don't know, but I think it'll be a beautiful experience.
It is definitely going to be dynamic. Lots going on off the main stage, lots going on the main stage. But thank you so much for being here, John Lumpkin, Tori Peoples, Langston Oliver. Appreciate you. Have a great Jazz Fest.
Thank you.
Thank you.
All right. Up next, exploring the intricate art of Islamic architectural design.
Life South Community Blood Centers, providing blood and patient services to the local hospitals, serving patients in this community. Donating blood with Life South helps save lives. More at lifesouth.org to find a blood drive near you. The law offices of Phillips, Hunt, and Walker proudly support WJCT. Personal injury, criminal defense, and family law. Phillips, Hunt, and Walker, committed to justice. 904-444-4444 or floridajustice.com.
On the next Fresh Air, ProPublica reporter David Armstrong explains why some critically needed prescription drugs are so expensive in the U.S. It's a subject he knows from personal experience. A single pill of the cancer treatment he takes costs roughly the same as a new iPhone. Join us.
Today at noon on WJCT News 89.9.
Cari fratelli e sorelle, buona domenica!
The world's 1.4 billion Catholics have a new pope, but the church Leo XIV now leads is far from unified. I'm Meghna Chakrabarti. The challenge is facing the first ever American pope. That's on the next On Point.
Today at 11, here on WJCT News 89.9.
It's a must-have for any city preparing for the future, a strong digital backbone. Next time on 1A, we look at how today's leaders are taking charge of their own digital ecosystems and how they're planning to deliver for the future needs of all their residents. We have perspectives from two pioneers, the mayors of San Antonio and Chattanooga.
Today starting at 10 on WJCT News 89.9.
Welcome back. The ornate design of Spain's iconic Alhambra Palace is the focus of an upcoming art and cultural benefit. Here to tell us about it is Dima Kroma. She is a visual artist and the event's guest lecturer. Good morning, Dima.
Good morning.
We are also joined by Dr. Mohammed Alhaj Mustafa. He's a hematologist and medical oncologist at Mayo Clinic who specializes in the diseases of leukemia and lymphoma. Dr. Mustafa, thanks for being here.
Thank you.
So, Dima, you are from Syria, but you moved to the U.S. in 2010. How has that experience shaped your artwork?
So my moving to the United States as an immigrant made me want to tell people about my home, especially because of what happened in Syria, the revolution. So people only thought about Syria of place of war, but Syria is a beautiful place. So I wanted to tell people where I came from and bring awareness of that wonderful culture. So I started to paint and tell stories about Syria. And this is how I started the art. And that art was like memories were the only thing that connected me back home when I was unable to go anymore. Thankfully, now we're able to go back and it's going to be amazing. So yeah, that's how I started to do art here. And that's why I do art about my homeland, my culture. And currently I'm doing art about my new home. I became American a month ago.
Well, congratulations.
Thank you.
That's a big deal.
Thank you. So in my thesis, in the MFA thesis last year, it was about my two homes, Syria and the United States.
And for people who are watching our live stream, we're looking at some of your beautiful paintings. And you really try to kind of, bridge this cultural divide, if you will, or to kind of show that there's less of a divide perhaps than some people think. But I mean, of course, Syria has an incredible cultural and artistic heritage.
Yeah.
And is it important when you do lectures to kind of help people connect the dots there on the similarities between these cultures?
Yeah, sure, definitely. I always highlight the similarities between culture and art. Is it's a language, everybody's language. It's not like only for one area or one region in the world. So when we do art, we connect, and even if we don't speak the same language, even if we're from different cultures, we're together when we do art. And that's why I choose to do art for such events also.
And Dr. Mustafa, this is an event that's coming up. It actually is benefiting the research, that is kind of behind the medicine that you practice. So leukemia, lymphoma society is going to benefit from this. But why is it important to kind of have it wrapped in this nice kind of cultural eggshell, that sort of encapsulates there's going to be food, there's, this visual component. People are going to be able to produce their own art. It's a really kind of multifaceted event.
Yeah, so I would say I'm a hematologist and oncologist and see all patients with cancers, right? And typically patients with cancer they do not only suffer from emotional and financial and physical. They also have a lot of issues that goes on throughout their journey, and they cannot express it to other people. So with me trying to fund this Leukemia Lymphoma Society, I try to also at the same time I try to create some kind of community, some kind of culture around these events, so patients and doctors and artists um, can join these events, can talk to each other, can have some kind of fun, cultural creativity. These events, kind of, I see it as supporting my patients just outside of the fundraise that I do. So that's why we're running these kind of events.
And you talk about, the needs that they have. What kind of support do they most need when they're going through these kinds of treatments, or just even when they get an initial diagnosis? It can be so troubling.
Well, initial diagnosis is very impactful on these patients, and they feel isolated. As a cancer, patient, the community around you don't understand what's going on with you. So these diagnoses impact you, physically and then emotionally, and then also many patients in our community, they suffer from financial impact of these, cancers. So what we try to do is by funding the Lymphoma Leukemia Society, they, they have multiple aspects on how they support patients. First is, financial assistance, also support cancer research, which is very impactful. And also a third, sorry, and also a third would be supporting them educationally. So the Leukemia Lymphoma Society provide a lot of educational sessions, which I run some of it. And that is very impactful on their journey.
Dima, this event that you're doing is going to sort of focus on the Alhambra Palace, as we said, which is just an architectural marvel, and you're going to show some images of it and then encourage people to kind of do their own drawing. Can you just briefly tell us what you're going to assign?
Yeah, so I'll be talking about Alhambra, some secrets, some interesting information about it, the gardens, the beautiful gardens, the amazing, mesmerizing geometric patterns there, even the ceilings. Like it's a beautiful marvel of architecture. So I will be talking about it in a presentation. And then we'll be drawing these geometric patterns so we connect more to this place. Because these patterns, why I chose these patterns, the geometry, because this precision, the repetition, the unity, the proportion, the harmony, they all together bring this mindfulness, the calm to people. So they are also connected to healing. This is connected to healing. Also the unity, these patterns, like one of the most important aspect of these patterns is the unity. And we as a community, we need to be united for such noble causes like supporting the cancer patients.
Well, it is an event on Saturday, May 17th. And it is going to have all materials. There'll be a meal. Dima Kroma, Dr. Muhammad Al-Haj Mustafa, thank you so much for being here. I appreciate it.
Thank you. Thank you so much, Anne.
And thank you for listening. I'm Ann Schindler. This is First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com.